there, welcome to the program. This is Our Healthy Homes. OurHealthyHomes.com is the website to go to. 651-775-9194. That's the big phone number to call. That's the Health and Wellness Hotline. That's the red phone, the lovely and talented Sheila.
For some of you that are older will understand the red phone. For some of the younger people, they might not get the red phone, the hot phone, the Get Smart phone, the Dean Martin phone.
I thought that was the nuclear war phone that's in the president's office.
Okay, well, that too, probably.
All right.
Okay.
All right. 651-775-9194, the lovely and talented Sheila. I'm Keith Hittner, Sr., and we are here with you from Our Healthy Homes. And we talk about the four pillars of a healthy home. Of course, the structure itself, the interior spaces and the ecosystem inside the house, your physical body, and your emotional and spiritual well-being. All four pillars have to be in place, strong and powerful, or the roof comes tumbling down. I'm not even going to give you the option.
Okay, that's all right. I'm good with that.
The roof comes tumbling down.
I don't say it his way.
Okay, we're going to talk with Marlee Dukek today, and we're going to talk about Restore Hyper Wellness. Before we get into that, Sheila wants to just give us a little bit of a rundown on the Muffin Top Meltdown. And what's going on with that program. Just about ready to launch that program.
We are just about ready to launch that. I've got a couple people that have been in my trial, right?
The beta
testing, thank you. And so we're getting close and super excited for that. And, you talk about like one of the pillars, is the healthy home and the foundation and things like that. It goes into the same thing with your health, right? We have to have a foundational place to start and place to be before we build on doing detoxes and cleanses and things like that. So you have to have that foundation strong to be able to take what's going to come with melting down the muffin top, right?
And that's so important because just stop to think about Lily just was approved today, FDA approved on a new obesity medication. So what that's supposedly going to mean is that you take a pill and now you can eat anything you want because it prevents the liver from doing what the liver was supposed to do, as I understand it.
Oh.
So to me, it's like, okay, that in about a decade, we'll start seeing the impact of that on other things.
10 years is the typical time frame that we see when a company brings out like the Johnson & Johnson lawsuit, like a chemical added into something, is typically about 10 years before there's enough people getting sick, the lawsuit starting to happen, and then the change taking that chemical out, putting a new one in, and the cycle of the next 10 years to do that. So, wow, can you imagine the list of side effects coming on that one? Wow.
That'd be
that one's going to be
10 minutes
big.
just to read them all off.
Yeah.
Well, here's the other thing is that it teaches people
no discipline.
to lack discipline, unhealthy habits.
We already have that in this world.
Well,
a lack of discipline.
So we're going to do the right thing here, and Marlee is going to help us along the way. We're talking about Restore Hyper Wellness in Apple Valley, Minnesota. First of all, just tell us a little bit about what that is. What is that? Who are you? Why are you here? And why should we listen to you? Kind of want to know about that. So let's start with that. Who are you? Why are you here? How did you get involved in the health and wellness field?
Sure. Well, I'm a registered nurse. Thank you. I'm a registered nurse. Restore, it's a health and wellness company. It's been a company for about 7 or 8 years now. It started in Austin, Texas. The creator of Restore, he actually was training for a marathon, and he was really looking up the benefits of cryotherapy. So Restore started primarily with Restore Hyper Wellness Cryotherapy.
Good things come out of Texas.
That's right. Yeah. I'm very thankful for that Restore has become what it has become. We offer several modalities. Most of it is focused originally off the thought of helping people who are training for marathons, people who are athletes, people just to help them recover so that they can do more and recover faster, which means they can perform better. So that's kind of where Restore got started, and it's kind of spread out into IV therapy. We have an esthetician on site that helps with skin health. We have 4 core modalities and a few other modalities that just kind of help with overall wellness.
We're going to get into those later.
That's right. Yeah.
So you a registered nurse.
Mhm.
So are you a practicing registered nurse, or are you fully on board with Restore?
So I work as a registered nurse at Restore as well.
Oh, at there.
Okay.
Okay, got it. Got it.
So there are some modalities that require a registered nurse to perform them. So like vitamin IVs, hyperbaric oxygen therapy,
Oh, my
those
favorite.
things. Yeah. Yeah.
Okay, so how did you get involved in that? What made you interested in
Well, how'd you
doing
find
How'd
that
you find
job?
it?
That's what I want to know.
Yeah. So I originally had started with, I was working in the emergency department, and during the pandemic, I was just really feeling burnout, but I didn't really want to not be at the hospital. So I was like, well, maybe I'll find something else to just kind of, spread myself out, and I can still work, and hopefully I'll find something that I like. I had applied at Restore. I did my interview. Initially, I was, just going to work 1 day a week, and I did 2 days of working, and I was like, I will be here all the time that you want me to be here. Because
How did
I
you
love
hear
this.
about them?
I honestly was looking on Indeed and found, and I was going to the gym right across the street from the Woodbury location, and I'd
Okay.
been going there for 4 years and had never even looked across
How
the
many
street.
locations are there?
There's over 200 now nationwide, and there's 5 here in the Twin Cities.
So you're across the street from this place. It never even came up on your radar?
Yeah.
And all of a sudden you see it on. When you went in there, what was your impression when you first walked in the door? Now you're coming in. You don't work there yet.
Right.
And you're coming in. And you're like, what was the thing that just really struck you about the facility and about the place?
Well, it was very clean. It was very modern. There was things going on that I had never seen. There's a lot of people in there. The clients, they seemed all super excited to be there and just really relaxed. The staff seemed very just also very excited to be there, which you don't see at a lot of places anymore. It was just that, like, as soon as you come in, there was just this presence of wellness there, emotional wellness, mental wellness, happiness, and you could just feel it as soon as you go through the door. And I still feel that way when I come into work. It's just kind of like, I'm so happy to be here.
A happy serving atmosphere.
Yeah.
Happy to serve. It sounds like that the employees are happy to serve.
Exactly.
The people that come in.
Okay, so you're in there, and who are your? The first thing that comes to my mind is that you're dealing with injuries of some kind. When I hear people saying that they're recovering, is that accurate? Is that what your main focus then is, on helping people recover from injuries, or what?
Well, from a company perspective, that's kind of where we got started. Through my experience of having worked there, I've worked there for 1 year and 7 months now, and I see that we help people recover from all kinds of things, illnesses. If you have a cold or you were in the hospital and you're like, I just don't have my energy back, you come in, you can do some of our services. You can get an IV drip. We can recommend vitamins for you that are going to help replenish what you might have lost. That's going to help you recover. Some people are recovering from different illnesses mentally that they really just kind of need a boost, something that's an adjunct to what they're already doing. And I've seen
such as
explain that to me.
The mental, such as
PTSD.
Okay.
People with severe depression.
Okay.
We have therapies that are very helpful and adjunct to what they're already doing. I've seen it work for people, so I really believe that we can help people recover from all kinds of things, really, not just injuries.
When we come back, I want to talk about
your mental health.
My mental health, yeah. Let's talk about my mental health. I want to talk about when someone comes in and you say you give an IV drip of, whatever.
I got a couple questions around that.
The concoction is. How do you know what to give them? Do you have different ones? I mean, do you have, concoction A, concoction B, concoction C? What is the menu to choose from? And how do you know what somebody needs? Or is it a one-size-fits-all?
Well, I do believe that all the vitamins and minerals that we offer on our menu, they do have a benefit to everybody in our lives. A lot of them are essential vitamins. Some of them have their own purposes, but through us nurses, we're very well trained through whenever we're started on onboarding. We're encouraged to learn as much as we can about all of our ingredients and how they work well together. So, for instance, we offer like glutathione and vitamin C. Glutathione.
And those two work well
together.
together.
They work super well together, and just knowing that and how they're going to work for somebody is really where we get started.
Orange is the highest oil in glutathione, by the way.
Good to know. When we come back, I want to talk about the actual onboarding, like the whole interview process and how it would, if I just walked in off the street, kind of feeling a little mélange, and how you're going to help me out. This is Our Healthy Homes, ourhealthyhomes.com. Check it out. Sign up for the Muffin Top Meltdown program if you have
on the
need.
website.
On the website. Be right back. Welcome back. Thanks for staying with us. This is Our Healthy Homes, ourhealthyhomes.com, with the lovely and talented Sheila, 651-775-9194. Our Healthy Homes, the 4 pillars of a healthy homes. You can go to ourhealthyhomes.com, read all about it. But we're going to start talking again back with Marlee Dukek, and we're talking about Restore Hyper Wellness. When we went out to break, I just wanted to know kind of about the interview and the onboarding thing when someone walks in and says, I'm just not feeling right. What can you do? First of all, how would they even know to come to you? What kind of promotions or marketing, or are they sent to you from another medical professional, or how do they arrive at your doorstep?
We get a lot of referrals. So a lot of people are like, oh, yes, this lady that I know in my neighborhood, she talks about how she's been going to Restore, and she says how much it helps her. Or we try to do events in the communities to get our name out there. Honestly, it's a lot of referrals.
Okay, so you two met at the
Dakota Electric Health and Wellness fair that they had for their company.
Okay.
And so if you have a company that does a health fair, health and wellness, reach out to us, because we like to be there.
All right, so now I come in. Now let's kind of go through the interview, the onboarding. I'm assuming you have a questionnaire of some kind. Just tell me about that.
Sure, like as a new client?
Yeah.
Yeah. So whenever you come in, we have waivers for everything.
Okay.
Of course.
Yeah.
Yes, liability, of course. But, there's risk with everything. But the waivers just make sure that you're safe to do our services. So you would start there. If you were coming in specifically for an IV, you would do a medical health history form. You meet briefly with a nurse practitioner.
But how would I know if I need an IV? Isn't that something you'd tell me?
Well, so you would tell us how you're feeling. We get a lot of people that are coming in. It's like, my friend said that she loves coming here, and so she recommended that I come in. I don't even know what any of this stuff is.
That's me.
Yeah.
I feel great, and I want to feel better.
That's right.
A lot of times though, like I had gotten a vitamin drip or whatever. It was shortly after we had COVID, and I went to my hormone specialist, and she said, it would just probably be a good idea just to jumpstart some of those vitamins, because we really don't know how much you lost during that time, during the time of COVID, and that what you depleted yourself in. So let's just boost you back up. So we boost your immune system so that you stay right.
So what's
healthier.
The difference between the vitamins that you're giving intravenously and the high quality vitamins that I take every day?
So that's a great question. So the vitamins that you're getting through the IV, they're actually bioavailable, which means that your body is able to use it. So this is something that I learned after COVID. I was attending a seminar with this company who does nutrient testing, and they said that after COVID, they found that a lot of people are getting leaky gut syndrome, so they're just not able to absorb nutrients through their GI tract as easily as they were before. And so whenever you're getting your vitamins through your IV or through the muscle, it's bypassing that GI tract, and your body, it's circulating, and it's able to go to places it needs to be absorbed, and your body's able to use it because it's more bioavailable, which makes it a nice boost of vitamins versus just taking it orally, because you're only able to absorb at normal function about 20% of what you take orally.
Yeah, when you take over, like, wherever you buy them, typically it's that 20 to 30, and then Young Living infuses theirs with essential oils, so that makes that bioavailability 80%, and so then this is probably like 100%.
Yeah.
So is it like you got to sit there for a couple hours with the IV in?
It's typically if you're just getting one of the IVs that we have on our menu, typically it's 45 minutes to an hour. It depends on a lot of things, how much ingredients you're getting in your IV. Some ingredients need to be diluted in more saline, so that takes a little bit extra time for that to infuse. Some of them do have time limits, like magnesium needs to be infused slower.
So it isn't just one bag that you're doing, it's multiple rounds of.
Yeah, so you would start with 1 liter of saline.
Okay.
You get to choose between lactated ringers or normal saline. Lactated ringers has more electrolytes in it. The pH is more like our blood, so some people prefer that.
How would they know one from another?
We would give a good recommendation for
Okay.
them. If they're not if they're not dehydrated, they're not depleting their electrolytes as quickly, they would be fine with normal saline. But those who are sweating a lot, those who have been dehydrated, maybe they just got over an illness, we would recommend lactated ringers for them.
Okay. So every time Sheila walks in the room, I kind of break into a little bit of a sweat.
Yeah, you might need lactated ringers.
Okay.
Yeah, exactly.
Yeah.
So how do people feel then when they're done? Do people report that after they're done, that wow, I feel this brightness, or is it something that comes on gradually, or they don't really notice, or what are the reports back from?
Yeah, it kind of depends on their purpose of getting the drip and what we've recommended to them. Sometimes we're able to give them all the things that they need, and sometimes they're like, I really just want to focus on a few things right now and not overdo it today. So then, and I've had people that say they feel better immediately, like as soon as I get the fluid. Sometimes that fluid, like
They feel bitter.
better.
Okay.
Sorry. Sometimes they'll say that they feel better right away, and then other people, I usually tell them, you should be able to sleep a little bit better tonight. Tomorrow, you're going to notice the effects. Like
what they feel tomorrow.
they'll feel better rested.
Okay.
Decreased brain fog, more energy. It's
Do you
typically
see
three
that
things.
it matters? Does it matter with age? I mean, do you see like people in their 40s respond differently than people in their 60s and 70s?
Yeah, I would say so. We see a lot of people in their 20s too, and they don't really notice the effects of the energy as much because they already have a lot of energy. They're in their 20s.
Yeah.
Versus somebody who comes in their 40s or 50s, they have kids, they have a busy job. They could use a lot more benefit of a balanced nutritional intake, whether that's vitamins, their diet, or just supplementation in general. But those clients typically notice it better, those
And
in
we
their
have
40s
friends
and 50s.
that go and get their vitamin shots every month, and they just she says she feels a difference, and she's in her 60s, and she just
Well,
thinks
that begs the question then I mean, like food, you eat, in
right.
24 hours you have to eat again. With a vitamin infusion like this, how often is it recommended? I mean, it seems to me that in 24 or 48 hours it's all gone anyhow. So then what you got to do? Do it again?
Yeah, so it just kind of depends. I mean, we don't always need the exact same thing all the time. Sometimes our body's using more of certain nutrients to fight off illness, and sometimes they're using up more of another nutrient to combat fatigue. So it just kind of depends, and so we keep it very fluid. All of our IVs, we give each individual ingredient by itself, so we don't mix it all into the saline bag. It's not pre-mixed. It's totally personalized. You can come in and say, hey, I'm feeling this way. I know last time I was really tired, but this time, I have a competition, or I have a bunch of things to do this weekend, so I really need to
Boost my energy.
Or hey, I'm traveling, so I need to boost my immune system before I go and fly or go to this other place that I just don't want to get sick.
So when I met you, you had this compression chair thing, and so I got in it, and it was all the way up my legs, and it was like the suction and then the vibration on my legs. What do most people come in? Why do most people use that? Like, what's that purpose of that machine?
So a lot of people, it's really good for muscle recovery. So it increases blood flow to your legs.
Okay.
You could do legs, arms, or hips. Hips are great for people who do carry a lot of stress on their hips. It helps with circulation and moving things.
Carry stress in your hips?
Yeah.
Explain that to me.
Well, I used to do a lot of yoga, and
Okay.
we'd always do these hip openers, and they said that we carry so much stress in our hips, like emotional stress, physical stress, because it's the biggest hinge point in our body. We put a lot of weight on our hips. We sit on our hips. You're always using your hips.
So I this little foot thing has been coming, to me. It's been coming and going and coming and going. And so my friend who, does PT and all sorts of stuff. So she was over the other day. She's working on me, and she's like, "You gotta loosen your hips." And I was like, "What?"
I've been telling you that for years.
Yes, you have. So it seems weird, but doing the child's pose, or there's just some things that I need to do to work on the hips, because there is so much truth to that. And we can stretch and we can twist and we can do a lot of things, but a lot of people don't think to work on the hips.
Right. Yeah. Because if you're not having pain,
so that
you
compression
don't think
thing that goes around the hips.
Yeah.
So then it in out, sucks in out, moves the lymph.
Yeah.
Okay. We got to go out and pay some bills. When we come back, we talked about a couple of things now. I just want for the listeners I want to hear the modalities that you have, so people can just get an idea of what, and just describe each one briefly.
Sure.
And what kind of recovery that they would help with. This is Our Healthy Homes. Hey, welcome back to the program. Thanks for staying with us. Appreciate it. This is Our Healthy Homes, ourhealthyhomes.com. 651-775-9194. That's the number you call. Get hooked up with the Muffin Top Meltdown. Sheila, give them a brief description of what exactly that is, and when's that going to launch?
It is going to launch December for sure. You're asking for a commitment. Yep, December. I have a passion to help women over 40 that have tried just about everything to lose the weight and lose the muffin top, and they're ready to focus on themselves. The kids are older, and now it's time for them to take back their health. And it isn't just about food and exercise. You've done the damage. We've done the damage to our body over time, and now there's some specific things that we need to do in a specific order to prepare, cleanse, move the body, and get rid of the things that are holding you back from that happening.
So
right?
People are tending to say, or they're tempted, I should say, to say, well, I'm just going to take one of these new pills.
Oh, yeah, right.
And I'm going to lose the weight and get rid of the symptom. And that really, ladies and gentlemen, is the symptom. What we're talking about is restoration, full spectrum restoration.
And it's not going to be quick like the pill. This is, going to take some time. And
right.
Right. But it will work.
And it's permanent, and it's guaranteed, and it works 100% of the time. Okay, so we're talking with Marlee Dukek, and we're talking about Restore Hyper Wellness. The location that she's at is the one in Apple Valley. I want to know the different modalities that you had, because in the first segment you mentioned that you had the different modalities. So just briefly explain what they are, and I see them as like pillars. Do they ever interact with one another, or do you do multiple modalities with individual patients, or are they kind of gravitating towards one thing? Just kind of run through the modality thing.
Yeah, so we have 4 core modalities, which is cryotherapy, red light therapy, an infrared sauna, and compression therapy.
Okay.
So those are considered our 4 core modalities. We also have, like we talked about, the IV therapy, the intramuscular shots. We also have a mild hyperbaric oxygen therapy. We have local cryotherapy if you're not really into the whole body coldness. Some of us get enough cold year round that we're like, yep, I'll just stick to a little.
Put a cold pack on your knee, kind of a deal. Or?
It's a cryotherapy machine, but you're able to localize it to one area. So it would be your knee or your ankle, or
so I don't have to get in the full blown freezing cold.
Freezy.
Right. Right. Exactly. We also have an esthetician in store, so she can do slimming, cryotherapy slimming, and cryotherapy toning, which helps.
How does that work?
It freezes. It kind of works like freezing off fat cells, and the toning helps tighten up the skin after you've lost weight, or if you have some loose skin that you want to take care of. She does facials, like a hydrofacial, a cryotherapy facial, and an oxygen facial, which all have different benefits to it. But with our core modalities, the cryo, sauna, red light, compression, we do recommend that people use them, like multiple of them, because we get some people that come in, they really want to just do cryo, and they're like, oh man, this really helped me with my sleep, but then they get bored of it after a while, or it stops working as well for them. It's like, well, now it's winter time, and
all I gotta do is go outside.
Right, exactly.
10 below zero.
Or do a snow angel.
Yeah.
So people will recommend that they do the sauna and then do cryo, or they'll do red light therapy.
And what type of sauna is it?
It's an infrared sauna.
Okay, far infrared?
We have
near.
I think it has near infrared, and you can change the different light therapy in it. So you can choose blue light, red light, purple light. Each light has different benefits. Red light and near infrared light seem to be the most popular amongst light therapy, because they've found that near infrared light and red light have a ton of benefits. And we'll just start with red light therapy. Then we have I was reading a book about red light therapy, and it said that we've used light therapy for thousands of years. So whenever people come in, they're like, I've never heard of any of this stuff. I was like, you have, just not in this modernized way. And that's what Restore is really good at, is taking old time and true therapies and just modernizing them and making them available.
So explain red light therapy then, how we've been using it for thousands of years. Is that like just going outside and play?
That's the part of it that I was like having a hard time grasping, but we know that we get vitamins from the sun.
Right.
We know that it's good for us with our vitamin D production. We know that it's good for different chemicals in our brain that help us be happy, that help us not have depression and lessen our anxiety. We know that light therapy has so many therapeutic benefits in that way. And that's kind of what we say with our red light therapy too, but they've also seen that it can, near infrared light and red light can penetrate the skin and go to that tissue just below the skin and cause healing effects for sore muscles, injuries, decrease inflammation, but things like that.
So I read, as you get older, you get a little bit nervous, So I've been reading about longevity. And then all these modalities come in all the time when it talks about longevity and living long. And basically what they're saying is, in a nutshell, keep your body well tuned, well oiled, like any machine, and it'll run for a long time. Mistreat it, don't change the oil, don't use it, let it sit on the corner, and when you want it, when you need it, it's not going to be performing, or it will break. So with that in mind, do you have, like, for people who come in, clients that come in, and you say, I want a general overall, I'll do all of them.
I want a checkup.
You tell me what to do.
I want to change my oil.
Yeah, I want to come in and do a tune. What does that involve? How much of a time commitment is there? What are the costs involved in all this? I mean, is this expenses? Is it cheap, or
is it a membership?
How does that all work?
Yeah, so we do have a membership model in our store, so that's where you save the most money. You would sign up, you would choose which membership fits best for your life. That gives you a certain amount of core services, like we had talked about, those core modalities for a month. They roll over, so if you're like, I had a really busy month, I was out of town, what have you, life gets busy, you can roll those over for several months. But that you kind of decide, like, hey, I want to do cryotherapy once a week and I want to get an IV drip at least once a month. Then we could find a membership that fits that, so that it's all encompassed into that. Otherwise, some of the things aren't covered with the membership, such as the facials. You get member pricing. There's member pricing versus non-member pricing. We do encourage the memberships, because that is where you save the most and you get the most value for it that way.
And everything's available to you.
Everything's available. Yeah, I mean, everything's available if you're not a member also, but
just more money.
It's just more money. Yep. We do take HSA and FSA. So at the end of every year, people that have memberships are like, oh, I have all this HSA money. It's like, you should have told us. You could have used it for your membership. But yeah, we take HSA and FSA as well, which is a huge benefit.
So how many different, describe then your membership levels and generally what the costs are.
Yeah, so we have a Discover membership, which is typically for the people who are just kind of getting their feet wet, and what Restore has, in the Restore modalities.
Mm-hmm.
They're like, yeah, I could probably commit to once. It's like me whenever I first applied there. Yeah, I could work once
Sure.
a week. And so they'll come in. They've got 4 credits that they can use. They can use the 4 credits towards a membership, or they can use that and do 4 core services. Or sorry, they can use their 4 towards an IV.
Okay.
And then there's a level up membership, which allows you to have 8 credits a month. So 4 of those could go towards an IV. You could use all 8 of them towards an IV, or you could split it up, do an IV and core services.
So what was that first one cost-wise?
We just changed our
Pricing,
last
okay.
Monday, so I don't really remember.
Okay.
Generally,
I think it's 110.
Okay, so
Okay.
it's
Yeah.
$100.
Yeah.
All right.
Yeah. And then the next one I believe is $189 a month, and that one provides the most value to clients because they can get an IV and they can do a service every week if they want to.
Mm-hmm.
And then the next one would allow you to have 14 credits, and so that's you can just mix and match. You know, we have a core membership, which
Mm-hmm.
is just core services. You can do a service every single day, so you get 31 credits a month.
Wow.
Yeah,
That sounds like a lot. I mean,
A lot of work.
A lot of work. I mean,
That's a
lot
job.
of time commitment. I
Yeah,
mean,
that's like a job.
to go, especially if I'm going to get IV there, and it's 4 hours to get one done.
45 minutes.
It's 45 minutes. What were you talking about? 4 hours.
Mine took a couple hours
Okay.
where I went. I had to sit there
Okay,
for
45
a
minutes.
couple hours.
Yeah.
And
Do you do home visits?
we do actually, yeah,
Oh.
for
Really?
IVs, yeah,
Oh, see, there you go.
yeah.
Now you're talking.
We call it our concierge services. Yeah.
just the IVs or what else?
Yeah,
Well, I
so-
suppose because you can't take the machines.
Right.
Yeah.
Yeah. I mean, we would offer compression if somebody was like,
Oh,
yeah, I
okay.
would really like to do compression and an IV, and then they could do shots as well, the
Okay.
intramuscular shots.
Now you're talking my language. I like when people come to me. This is Our Healthy Homes. We got one more segment to go. OurHealthyHomes.com. I want to know what your favorite deal is. OurHealthyHomes.com, 651-775-9194. And we'll be right back after these messages. Thanks for staying with us. This is Our Healthy Homes, OurHealthyHomes.com. Marlee Dukek's here from Restore Hyper Wellness. We've been talking about different modalities to get you all tuned up and living large in the city. What's your favorite modality? What is a favorite thing that you do as often as you can there?
I like the red light therapy, honestly. I tell this to all
So
my
is that
clients.
like a room that you go into, or what is that? Because I've been to some places where they have a light therapy. I don't know if it's red.
You stand in front of it
You
in a
stand in
closed
front
room,
of it, a closed room, different colors.
type of a
going on.
bed.
Yeah.
Yeah, so the Woodbury one has a bed. It looks like a tanning bed. So
Okay.
the red light and near infrared light can't penetrate your clothing, so you get down to your comfort level. It's
Okay.
obviously a private room.
Okay.
Mhm.
You can lock the door, of
Sure.
course. And you get down to your comfort level, and then you could get into this bed. The one at Apple Valley are these 2 stands that have the light, and so you would stand in between them. And so what I typically do is put on a podcast or an audiobook or music, and then I just stand in between it. But you just feel like I use this analogy a lot, like you're standing on a beach by yourself, and you're just having that like minute of peace
Mm-hmm.
where you're just like, you have no worries, you're warm, you just feel really good. You can feel like the warmth of the sun, because you do get kind of warm in it. But
Yeah,
What-
and it's very healing.
yeah, it's my favorite just for that reason.
And what benefits would one then get from that?
A lot of people have improved sleep. For me, I have reduced anxiety whenever I do red light regularly. All of our core modalities help reduce inflammation in some way. So red light's great for doing that.
How long are you in there for then?
It's about 11 minutes.
11 minutes.
Yeah.
Barely get into your podcast.
Yeah, really.
Light shuts off.
Right,
and you get
yeah,
all,
exactly.
Then you get all stressed out
Right,
because you
because you didn't get to finish
didn't get
it.
to finish your chapter.
Yep.
All right. So red light therapy, I get that whole thing, and it seems to be that that some kind of a light therapy is in almost every natural wellness center.
Yes. What about the hyperbaric chamber? This is what I know it as.
Yeah.
What's the max time a person can be in that?
So you can be at we call it pressurized. So
Okay.
whenever you're pressurized, you can be in there for 90 minutes, but it does take about 10 to 15 minutes to fully pressurize, and then about 5 minutes to depressurize. So then you would be in there for about an hour and 45 minutes to 2 hours.
Is that pure oxygen?
Now there
in
you
there,
got a
or what?
podcast.
What
Yeah.
is that? Yeah, there you get
The whole
some
movie,
good
if
stuff
you
in
want.
there.
Right.
Is there what's the air mix? Is it more oxygen in there, like higher oxygen content, or is it just air?
Yeah, so you would go in and we would put a nasal cannula on you, which is just the oxygen tube that goes into your nose.
Okay.
We would put that at about 4 liters oxygenation, so you would get supplemental oxygen while you're in there. And so the pressurized environment pushes that extra oxygen onto your red blood cells, which can go around your body, and it goes to places of healing. And it's at one of the big hospitals here in the Twin Cities, they actually use it for anybody who has had like an orthopedic surgery,
Sure.
people who have had any type of wounds that have a hard time healing, because that extra oxygen on your blood cells is really therapeutic for healing.
So I had it wasn't a bulging disc, but I had tore the tissue in the disc, and there's no blood flow or oxygen to get to that. So for 7 months, no bending, no lifting, no twisting, and that was the thing that I did that just really got me over my healing it was a tent one.
Yeah.
And I think I went in there for like 30 minutes at a time or something like that. And that is what really just, sped up my healing, was to get that oxygen to that tissue where the blood flow could not get there.
Exactly. Yeah.
Mm-hmm.
Yeah.
So from a layperson's perspective, when you're come out of the chamber, whatever it is, do you feel any different? Or?
Most people don't feel any different. We typically ask them not to drink any caffeine before they go in, because that
really?
it can potentiate caffeine. So it was somebody that worked there. He didn't realize that was a contraindication. And he went in and he was like, "Man, I came out, I felt like I could just take on the world." He's like, "I had so much energy." I was like, "Most people don't feel that way. Did you have a coffee beforehand?" And he was like, "Yeah, I did." I was
So
like,
how
"Okay."
far before should you not have?
We say 2 hours.
2 hours.
Yeah.
Okay.
Yeah. But most people don't feel anything. They just feel relaxed because they've just had an hour
Sure.
of me time.
A nap.
Sure.
Yeah. a
And
nap.
just to relax the mind. I
Yeah.
mean, just to take that hour away from everything, away from the phones, away from work, away from spouses, away from kids, like everything. That in itself is healing.
Yeah.
There's some benefit to that just alone.
Right. Exactly.
In or
When
out
you
of it.
add
thing,
another
but now
layer
you
of it.
add so I'm just like, what does it do physically to yourself if I have experiencing no symptoms of any kind? I haven't been injured, whatever it is. I'm just going to go into the chamber for a couple of hours. Aside from just the emotional piece that comes about, what is it doing for me physically?
Yeah, so we noticed that a lot of people, they sleep super well the night of and for several days afterwards. It is a therapy, so it's something that you have to do multiple times to see a ton of benefits. But yeah, most people say they sleep super well afterwards, and because they're sleeping well, they have more energy. They feel more relaxed because, obviously sleep is a huge part of our health and wellness, whether it's mental health, physical health.
On your intake form, client form, is the question, do you or have you had cancer on there?
For any services or for hyperbaric?
For just in general on the intake form.
It is, yeah.
Because I've known people that have used the hyperbaric chamber for their cancer that they have.
Yeah, we've had a client that came in and they were trying it out because they had read something about how it really helped with whatever type of cancer that they had. And I haven't read up on it, to be honest, but
And I was just curious if you had, like, quote cancer patients coming in for that therapy, because
Right, and obviously we're not prescribing that for anyone,
right. But we've had some friends that have done that.
but we do have friends that have done
Yeah.
that, and they've had good success with it. So
yeah.
um,
We get a lot of people who have done, their oncologist has recommended high dose vitamin C for them in adjunct to their cancer treatment. And so sometimes they're like, well, I couldn't get into them, so I would, this is how much he's wanting me to do, or my oncologist is wanting me to get in this vitamin C infusion. So they'll come to us, we'll get their oncologist recommendation form. And
I do love the fact that there are nurses, right? On staff, versus just going in and going to the tanning bed, or you know what I mean?
Right.
Just having some knowledge of each modality and just having the knowledge behind it.
Yeah. Our registered nurses are the only people that are allowed to do the IVs and the hyperbaric oxygen therapy chamber. We do all of these services under our own nursing license, so we do all make a really big effort to know as much as we can
Right,
about
make sure
all
you
of
get
them.
it right.
Exactly, yeah. Yeah, and all of us, we're all in the Apple Valley location, we're all ICU and emergency nurses, so we all have really good idea of kind of
what to look for. So if he's
Exactly.
in there and all of a sudden they start flipping, legs start wobbling.
Yeah.
Okay, so if someone comes and says, "Hey, I want to do the hyperbaric chamber thing," and it's like pretty definite, but that's what they want to do. Do you question them and say, "Okay, no, why is that?" Or do you ask them?
Yeah,
because
I could totally go in for that and get a treatment.
Yeah, just go in and do that. And why do you want that?
Yeah, figuring out somebody's why and what they want to do with their life, what are you hoping to get from doing services here at Restore? Are you hoping to spend more time with your grandkids? Are you hoping to have more energy? Are you hoping to perform better? Are you hoping to
I'm all about
better?
Prevention.
Yeah.
Like,
are you here for prevention? So it's kind of understanding what people's reason for being there in the first place is, and that helps us guide what therapies we recommend, which ingredients we recommend for them, which one, and then we can kind of monitor it too, hey, you had a race this weekend. We get a ton of marathon runners. How did it go? How did you feel? Or hey, you're practicing this week. Let's see how you feel before you practice, and that way we have it perfected of what you need to do before you do your big event.
Well, and everybody's different, so it's not going to be the same for everybody,
Exactly.
right? So everybody's level of abilities and injuries that they've had and recovery time and all of that is different, right? And it just sometimes takes a little bit of testing and figuring out and working through it to see which is your recipe for you.
Exactly. Yep. And that's the part that we try really hard in the beginning, because when you first come in, it's overwhelming, especially if you don't know any of the services. But we try our best to just kind of simplify it as much as we can the first time. And then the next time you come in, how did you feel when you did cryotherapy? How did you sleep? How did you feel like your energy level was? Okay, well, let's try it with this now. Or, you know what, maybe we won't do that because you felt this way. Let's try this instead. So
let's talk about that. I just want to touch on that cryotherapy because we've talked about it, kind of blew over it like everybody knows what that is, but everybody doesn't know what that is.
Right.
So what is the full-blown cryotherapy? What do you do? Just describe the process.
So our cryotherapy, we have a chamber. It gets down to 150, 160 degrees inside. So you go
150 below zero.
Below zero.
Okay.
Yeah.
Okay.
Yep,
cold.
sorry, minus 150.
Okay.
Right.
And so we do have you cover your hands, your face. You wear a robe.
So no bare skin.
Right.
Okay.
Once you've done it a few times, if you're still not dropping enough temperature, if your skin, we measure your temperature before you go in. We want to see a therapeutic drop of 20 to 30 degrees
Of your core temp?
of your
skin temp.
Of your skin temp.
Okay.
Yep. And so that therapeutic effect of your temperature dropping can cause healing, decrease inflammation, helps with sleep. I mean, it's very similar to a cold plunge. You're just not having that submersion.
Right. The wetness.
Yeah.
Wow.
All right. Well, my goal is to be 120 years old and be shot by a jealous husband. That's what my mission in life is.
We better go get some cryo and
do
some
cryo
hyperbaric
and
chamber.
some hyperbaric
and,
going on.
yeah,
Red
exactly.
Light. Our Healthy Homes. We'll see you next week.
But when he calls me sugar, I love that man with all my might. Sugar in the morning, sugar in the afternoon. Sugar after dinner, sugar in every room. He says I'm sweet as I can be. When he calls me that name, it does things to me. I tell him, honey, You can call me sugar.